Today's webinar, sponsored by MDaudit, is Beyond the Audit, How Billing Compliance is Redefining Revenue Integrity. So today we're going to take a really close look at billing compliance and how they're evolving as a major player in the revenue cycle and revenue integrity continuum. Just a couple of housekeeping items is my name is Dana Finnegan. I'm the Senior Director of Market Strategy at MDaudit. I've been with MDaudit about 9 years now, so really happy to be doing this webinar with you. A little bit about MDaudit is MDaudit has been in your space, the billing compliance space, the revenue cycle, revenue integrity space for well over 30 years. We serve over 200 customers with a nationwide footprint, and we're just very familiar with your ecosystem. And you'll see that as we go on, but we're your partner in billing compliance and revenue integrity. What we're here to present specifically is our 2025 benchmarking report. Every year, every single year, MDaudit compiles a benchmarking report. And I want to be really clear, this is not a survey. This isn't us surveying just a few of our customers. This is from all of our customers. Again, 200 customers nationwide. We are really diving into their claim information, their denial information, their auditing information, payer auditing information when payers are sending ADRs and requesting medical records and looking to do clawbacks. Just we're looking through a bolus amount of information and gleaning trends to let you know what we see going on in the billing compliance and revenue integrity space. So again, not a survey. You can see here again, there's 140,000 coders using this platform, $1.5 million of cases plus audited annually, 5 billion claims and remits in our repository that we are running AI over and finding these really important insights for you that we want to pass on to you. So it's a very comprehensive report that you'll certainly get a chance to read and get access to after this webinar. Some of the key trends that we wanted to kind of show to this specific audience, our billing compliance folks, is these going across here. The first one is denials on the rise. So I think we all know that payers with their adoption of AI are doubling down on denials, but just the pure rise in that is pretty significant. We're seeing here in just in 2025 that that's gone up 14% on the hospital outpatient side and 12% on the inpatient side. So those are not insignificant numbers. Those are double digits, which really kind of drives home that, since payers have adopted their versions of AI and are training their models to double down on denying you. We're going to dive a lot more into those denials, but certainly something that we want you to be aware of. On top of the denials, payer audits. So we talked about those briefly. When you're getting those pesky ADRs, whether they're from the government payers or commercial payers, this is where you've been paid, but you receive those ADRs looking to do, at the end of the day, they're looking to do clawbacks. And those alone have increased. The total at-risk dollars and cases alone have increased over 30% in 2025. So you've got a perfect storm of denials. And when you do get paid, payer audits looking to do some significant clawbacks that you need to protect yourself from and go on the defense and offense, quite frankly. And we'll talk more about that. On the far right, we see when it comes to actual denials, outpatient coding denials have really gone through the roof. In 2025, that we saw a 26% increase in very specific coding related denials. And that was on top of the year before, 2024, where we saw an increase of 126%. So if you add in 2024 and 2025, coding related denials, specifically on the outpatient side, have gone through the roof. And again, we're going to expose a lot more of this detail as we move on. Finally, we would just like to say that where we do see organizations in the MDaudit community really putting themselves in the driver's seat is when they're using AI-driven approaches to billing compliance and revenue integrity. We're going to actually do a short demo at the end of one of the newest enhancements to our platform that are really helping our billing compliance auditors use AI to interrogate the medical record and help them find opportunities not only to bill more compliantly but maximize revenues. But at the end of the day, using AI-driven approaches, prospective auditing, risk-based auditing, that's all the tools in the toolkit that billing compliance departments need to really stay lockstep with payers and maybe even get a step ahead. So those are just some of the major trends we saw from the 2025 benchmarking report. Now, we talk year over year trends. These are ones that we see that over the last 4 years continue to have an upward trajectory. So you'll see here, we're in all of these different stats here, we're seeing over a 3 year period, 2023 to 2025, but also continuing to go up very steeply in 2026. So we talked about some of this before, but it's not an isolated thing in 2025. The average denied amount for coding related denials continues to skyrocket over a rolling now 4 years. Information needed and medical necessity denials are also on a very high upward trajectory. That's where they're really challenging you as did this really meet medical necessity in really elongating the adjudication cycle by coming back and asking for more information. A lot of rework needing to be done on those, a lot of resources needing to be thrown at that to get the right information back. So we're seeing that as a huge trend as well over the last several years. Medicare Advantage, I think we're all aware of that for risk adjustment, coding and billing. Medicare Advantage plans have been under intense scrutiny by the OIG, CMS, and that relationship between Medicare Advantage plans and the scrutiny from OIG and CMS and others is really kind of cascading down to you. You're getting caught in the crosshairs of that, and there's a lot of denials for Medicare Advantage billing, particularly when it comes to those HCCs, and we'll talk more about that as well. And then finally, you can see on one of the most steep trajectories is that at-risk revenue from payer audits. We've seen just massive increases. I think it's over 5x from 2024 to 2025 of external payer audits. And that's important to the billing compliance group we're speaking to today, because when those payer audits come in, you're the first line of defense that we're all going to help us figure it out. Do we have a leg to stand on? Should we be fighting these payer audits? So again, we'll get into all of these trends more deeply, but those are things that are significantly trending up over many, many years. And we don't see them going down, unfortunately, but we want to give you some tips and tricks on how to defend yourself. So some of the very specific, those were kind of higher level happening to all of the different constituencies along the revenue cycle continuum. But I want to get really specific to billing compliance. And I think the first slide I want to show here is how billing compliance is really redefining revenue integrity. And in what this slide, I show this slide a lot because it's evolved over the years. But at the end of the day, not too long ago, billing compliance, despite the importance to the organization, was not getting a seat at the table. And when I talk about that, some of the most successful organizations in the MDaudit community and outside of the MDaudit community are folks that take an approach that everybody is kind of breaking down silos, working from the same data, sitting at the same table, even putting some egos aside to form a united front against payer scrutiny. And again, I'm highlighting, and we're going to talk more about billing compliance's job in this, but I'm highlighting them because, for many years they weren't included at that table for whatever reason, but now I think everybody is recognizing their importance, what they understand for what's causing overpayments, what's causing underpayments, what are the high risk coder populations, what providers are struggling. All of this information is vital to be kind of sat down at the table and disseminated with the other groups in the organization in that continuum, like revenue cycle and HIM and coding, billing operations. So the good news is we are seeing a major trend of billing compliance being a major player at this table, and everybody kind of looking forward to their insights. So if you're not at that table in your organization, bode for yourself because you have some significant information that everybody can benefit from. Um, so one of the biggest insights we came from the 2025 benchmarking report is risk-based audits increasing by 25%. Um, and again, this is 2024 versus 2025. So risk-based audits, I think of that, MDaudit thinks of that as continuous risk monitoring. What you're able to do and what you should be doing it as an organization is if you've got 1,000 providers or 5,000 providers or 100 providers, whatever that may be, big or small, the days of needing to audit them once a year and then educate them once a year are that those times are behind us a little bit. A lot of folks are now taking a risk-based approach via benchmarking, meaning, how do my providers' billing patterns compare to what CMS considers normal billing patterns by specialty? In the MD audit community, you can not only compare your provider's activity to CMS, but also to all of the other providers being audited within the MD audit community by specialty. So it's really a great way to say, okay, I've got 1,000 providers, whatever it may be, but kind of click an easy button to say, show me when compared to the MD audit community or CMS, who are my outliers? When I compare all of that claims data, all of their E&M leveling, all of their procedure utilization, who is an outlier? Who looks like they're overcoding? Who looks like they're undercoding? Risk-based approaches can immediately identify that at-risk provider population, that at-risk coder population. So as an auditor, you can come in and actually have a rank to say, today, my audit plan is 1 through 5 because these are the providers and coders causing me that overcoding and undercoding risk. So just know that risk-based audits are really skyrocketing within the MD audit community via continuous risk monitoring, benchmarking, and even some of the AI that you're going to see shortly. This one here, we talked a little bit about it before, but HCC audits up 102%, really due to that payer scrutiny on risk adjustment billing and coding. So as I said before, and this is an article I would really want you folks to read when you get the deck. It's really interesting read, is just because in May 2025, so very, very recently, CMS it really announced a significant expansion of its auditing efforts of Medicare Advantage plans. Medicare, there was some thoughts that possibly some of the Medicare Advantage plans could be inflating uh, some of the diagnosis codes and HCCs that they were presenting to CMS. So CMS is all over that right now. Huge part of their audit plan. This is extended to the OIG as well. So as I said, you're getting caught in the crosshairs. We know that as organizations and billing compliance folks, you're trying to do the right things. You're auditing these to make sure they're meeting the highest level of accuracy and integrity and that you're billing compliantly. But because of what's happening kind of above you and around you, you're going to get caught in the same scrutiny. So that's why we're seeing HCC audits in the MD audit community increase 102%. And one of the things I would say is if you don't have an easy way to kind of, I keep on saying, push an easy button and have a sample size returned to you of specific HCC codes being billed by your providers or being coded by your coders, make sure that you team up with us or somebody that can get you there, because you don't have time to be kind of hunting and pecking for those HCC codes. You just want to be able to say, show me this category, show me that category, and have a platform return you those sample sizes so you can be on top of this and get ahead of this unprecedented scrutiny. And that's something we can help you with if you're interested. A third one, and this one, I don't know how much longer I'm going to be presenting it, because prospective or pre-bill audits jumped by 30%. So, and that was quite an increase in 2024 as well. So in 2024, this was probably 60, 70%. This year, 30%. At the end of the day, really we see a massive shift from doing solely retrospective audits to going to the other end of the spectrum in doing prospective audits. We still really bode for you to do a blend, but going more towards the prospective auditing side is really where we see your world going. It's not the easiest thing, and we can help you figure this out. How do you suspend those charges? A lot of folks can put them in an Epic work queue if you're working out of an Epic billing system. You don't have to be in Epic to suspend charges. So technology can bring those pre-billed charges in for you so you can audit them before they go out the door and have dialogue with your coders before they go out the door to, again, make sure that these are being billed to the highest level of accuracy and integrity. But at the end of the day, I know many in the MD audit community are taking a huge shift to pre-bill prospective audits. Just know that, as I said, I've been with MD audit now for about 9 years. 9 years ago, it was all retrospective. 3, 4, 5 years ago, started moving a lot to prospective, and now current day, it's really something that almost every program has implemented and doubled down on. So you want to start doing that as well, and that's something we can provide best practices for you. Um, Now, this one is where I'm going to spend a little bit more time because it gets a little bit, I think, intricate. So this is where we talked about coding related denials increasing 26% across professional and facility outpatient settings. Now, that's this year. Again, to go back, I mentioned that the year before was 126%. So this is, if you take anything away from today's presentation, it's this coding related denials. Now, why is this happening? Well, it's pretty simple. Payers are doubling down on denials, specifically in coding related categories. They're employing their AI models to really parse out what you're coding, the intensity levels that you're coding, the high weight DRGs, the higher coded E&M visits, ED visits, critical care visits, and either denying those outright or down coding them upon receipt. So that's part of it. The payers adopting their AI models, but a bigger piece of this is now billing compliance has become really the headline, front lines of not only auditing human coders, but autonomous coding engines. And that's not an easy thing to do. We're going to talk more about it. So, you know, you've just started kind of to get your programs in place and streamlined for when you needed to audit coders and give the education and feedback and corrective action plans. Now you've got that second line of needing to audit autonomous coding engines. And in the way we see this going in the MD audit community is those folks using autonomous coding engines that do have a closed loop governance and QA layer over that are the ones with the highest levels of success. Where we've seen some not horror stories, but where we've seen some really difficult circumstances is where folks have employed the simple visit coding or any other type of autonomous coding and kind of leave it there on its own and not have heavy governance over it. That's where we start to see what's called coding intensity, coding drift. We're going to talk more about that, where those autonomous coding engines, if not significantly monitored, can really be sending out higher level intensity coding than it should be. So there's a lot in this slide, and we're going to bake it down a little bit more, but just know that as a billing compliance person, billing compliance department really should be boiling down and looking at your coding related denials, both coded by human coders and autonomous coders, autonomous coding on the outpatient side of the world. Now, some of the top coding related denials, again, this is taken right out of our benchmarking report. We won't go through all of these, but on the inpatient side, I'm going to ignore this diagnoses are not covered because that can just be one or two cases that, or more than that, but can really skew data. But I think the one that is a common thread in all inpatient, outpatient, and pro fee is this: payer deems the information submitted does not support this level of service. We saw that on the inpatient side. We're seeing it here. I'm sorry, inpatient side. We're seeing it here on the outpatient side as well. So particularly where the dollars are higher on both inpatient and outpatient sides of the world, this is where we see payers saying, okay, this may be we may like the coding on this, but it's not supporting the level of service. Provide us more information, send us the medical record. So there's a lot of rework with these, but these ones here are the ones that I would suggest once you get a copy of this deck in our benchmark report, you go back and kind of try to look at how your organization is doing with these, because these are the ones that we're seeing cause the most amount of pain. We're also seeing some major issues with procedure code and modifier mismatches. That's a really big one as well. So what we suggest is to be able to go and comb through those denials and really pick out the payers and the coding combinations and levels that they're kicking out for not supporting the level of service. Really kind of get those in front of you, and know going forward that for that billing, you should be attaching certain documentation and supporting information so you're able to get those paid on the first pass. But again, you'll get a copy of all of this so you can jump further into your denial population. And as we know, coding related denials are directly under the purview of our billing compliance folks. This is what I started to talk about a little bit about coding intensity and drift. This is not something that I was very familiar with until I started to really dive into it. And this is from Blue Cross Blue Shield Association. So if Blue Cross is noticing this, everybody's noticing it, and the payers are going to be highly scrutinizing it. So really what I think it's saying here, and I want you to read this article, you'll get this deck, is although there's significant gains in productivity, in efficiencies, by kind of automating through autonomous coding, the coding process, we're starting to see that there's a lot of cases popping up where what's being coded by those engines is kind of inflating the DRG complexity. That's where we start saying that if you're not monitoring this autonomous coding on a regular basis and there's not governance wrapped around it, that's where it causes intensity and drift, meaning you're starting to see the coding engine, and there's a lot behind this that you can read. It's fascinating, causing what's going on in the bill to be not truly reflective of what happened during the what should have been the real DRG assignment, and reflective of what was done for those patients. So again, just another article really where we're asking you to really wrap some governance around autonomous coding. This is also something I talked about at the beginning, educational assets that we want you to bring home. Again, you're going to have the benchmark report. You're going to have all the guts of the benchmark report to bring back to your billing compliance program. But here's something that we came up with just because of what we're seeing with that coding intensity and drift is 7 best practices for auditing autonomous coding. And this is something that, if you have autonomous coding, everyone in the billing compliance department, representatives, I should say, from the billing compliance department should be one of the leaders in establishing these best practices, or as I said, someone at the table that's part of this governance. So we're not going to go through this today. Just wanted you to see that there's going to be something there very helpful for implementing how you deal with your autonomous coding engines. So look forward to you reading that. One other insight, we talked about this a little bit, but requests for information. We talked about this already. They're going to come back and say it's not meeting medical necessity or additional requests for information. That has now, in 2025, gone up 70% overall across all settings. And you can see on the inpatient side, the increase is what's driving that 70%. It's 123% additional requests for information on the inpatient side. Outpatient side, 28%, professional side, 60%. So again, if you think about it, you're going to be sending out those claims and they are going to be asking for additional information. To get those actually, to send that information back and actually get it paid without additional denials is going to take months and months and months, which can really affect the bottom line. So again, great to have analytics on understanding what payers, what codes, what code combinations are causing those to bounce out for RFI, and be prospective and proactive with those submissions. And that's something that our billing compliance folks should be front and center helping with. The last piece I'm going to mention in terms of insights, and we talked about this, but we want to talk about the importance of billing compliance in this is the at-risk amount, payer audits, RAC, MAC, TPE, UPIC, that whole alphabet soup of folks that are coming back and saying, send us your medical records. Really, at the end of the day, they're looking to do clawbacks. Again, we see that going up 30%, not only in the number of cases being scrutinized, but the dollar amount as well. And the reason why this is so important is many of the folks on the front lines dealing with these external payer audits are maybe in the revenue integrity part or revenue cycle, more revenue integrity part of your organization. And they're getting bombarded with these at unprecedented levels. And they're going to have a very high dependency on reaching out to you in billing compliance to help them figure this out. They're going to say, look, here's the 70 accounts being scrutinized. We only have a certain amount of bandwidth to fight some of these. So you're going to be asked to go through that and figure out where you have, do your coding quality sniff tests and figure out where you have a leg to stand on, where you don't. So although this may be handled initially by your revenue integrity folks, the reliance and importance of billing compliance folks working these accounts and figuring out what to go after, what not to go after, is critical. If you're in billing compliance and you're not getting a front row seat into these payer audits and folks aren't asking you for your opinions and expertise, put yourself in that room, bode for yourself. You have a lot of great information to help the organization retain more revenue and refund less. And of course, there is great technology that's offering things like ESMD, the electronic submission of medical documentation directly back to requesters. There's also EMDR, which when you receive an ADR from the government or one of their contractors, it can be automatically ingested for you, scanned through AI, and get you in a fighting position to deal with these payer audits. And that's something MDaudit does offer, EMDR, ESMD, all of that. So if you're looking for help as a billing compliance person or revenue integrity person, certainly something that we have been able to help our clients with, and even put them in the driver's seat to sit down with payers during negotiations of contracts and say, some of this stuff you sent us was, baloney. And we want to talk about that now, giving you a much better posture at those negotiations. So be part of that as well. We know you need to be. And this is just, you'll get this. I won't spend too much time here, but this is some of the things that are under major payer audit scrutiny. I think none of us are surprised by the 871 on the inpatient side. The ECMOs are huge. Cardiac valves huge. These are in order as well. So this is when I talk about educational collateral and assets. Bring this back and see if this is why you're being audited by payers and what your outcomes are. And start to put some of this even on prospective audits, because the more you can audit prospectively, take more of a risk-based approach to some of this, you're going to see less payer audits at your back door. All of those things we talked about before can significantly mitigate payer audits and denials, like prospective audits, like taking a risk-based approach, using the same AI and the same sophistication that the payers are using, but you're using it. This is the last thing that I thought was really interesting, and I'll be honest, I didn't know this. One of the other things we see billing compliance getting heavily leaned on to help with is when billing is submitted, but there's auto down coding. We see this a lot with high weight DRGs, higher coded ED levels, higher coded E&M levels, critical care levels. They're being submitted and they're being down coded. Now, we're not saying that our organizations aren't trying to fight these, but it's happening at such unprecedented levels that it's hard to throw the bandwidth at it that you need to. It's also hard to identify when and where this is happening. So at the end of the day, I want you to read this article. I found it fascinating, but what it did tell me was by just accepting the auto downcoding, even if it's because it's literally you don't have the bandwidth, it's not just that you're ignoring it or being negligent. We know you're not. That this can pose a significant compliance risk. This can be looked at down upon negatively if you're not trying to fight these auto down coding. So a really great article we found in Rack Monitor, but it was a real eye opener for me. Years and years, I was on the revenue cycle side and saw down coding happening. And when I found out it could pose a significant compliance risk by just not by being non-responsive, it was a real eye opener. So this is also something as billing compliance folks, you want to be jumping in and identifying where this down coding is happening. Work with your coders, work with other folks to fight these when appropriate. Um, some of the 2026 predictions, they're going to be pretty straightforward, but this is the world we live in. Denials will become more complex, but also more preventable. How? You say how? Well, you, as billing compliance and revenue integrity folks, can do more prospective audits, but you can also employ AI and other sophisticated analytics to help you mitigate those denials. We're going to actually show you something in a moment. We expect payer audits to escalate. That's going to continue. So we just had a lengthy discussion about that. Those will continue. And at the end of the day, that thing on the far right, outpatient coding will truly determine financial performance for your organizations. I'm not saying that payers aren't doubling down on authorizations and pre-certs and other things, but there's really been a shift for many, many years. We always saw that the number one denial, we all just knew it. Like you could be sleeping, you'd figure it out that it was going to be authorizations, pre-certs, things related to coordination of benefits. Now, the number one thing that surpassed all of that is coding related denials and on the outpatient side. So, employing a pre-billing solution that can look at what's being billed, bump it up against payer policy, CCI, NCCI edits, MUE edits, all of those things, coding clinics, to let you know the needle in the haystack that you need to prioritize an audit before it goes out the door. We see a lot of success with organizations employing that type of technology. We have that in our MDaudit product suite. If it's something you want to find out about, let us know. And at the end of the day, this is pretty simple. Technology adoption it equates to survival. So you got to have technology to survive. And if you wrap the right governance around that technology, you'll not survive, but thrive. Um, so again, folks, that was kind of what we wanted to go through today. You're going to get a copy of this. Um, One thing I do want to do though is give a quick demonstration. This is going to be for many folks that are in the audience right now are from the MDaudit community, but many aren't. So for those that aren't, this may not make as much sense, but we want you to reach out to us and ask us about it. But one of the things I've done here, just to quickly explain, is I've asked my system to return to me all of the claims billed by this provider with these CPTs, with this modifier, and when billed to this payer of Medicare Part B. So I've created a query and I can hit these arrows and the system's going to immediately find everything I've asked for. I'm not dealing with data. I'm not dealing with spreadsheets. And then I tell my system, just give me 25 of those. That's a truly random sample. It's statistically significant. And what's nice is I'm being returned immediately the case list. Now, what I'm able to do now as an auditor is go in and see what went out on this bill. I can do this prospectively, I can do it retrospectively. We accommodate both. And I can go in and say, hey, that primary diagnosis, that looks right. I'm going to agree with it. Or I'm going to edit it. I may, from reading the documentation, see that there's a code that meets higher levels of accuracy and specificity, and I can edit that. I can do that with my diagnosis codes, my CPTs. I can do this on the inpatient side with DRGs and HCCs. Works for everything. But now what MDAudit has employed is what's called Auditor Assist. If I click this little button right here, it looks like a star. You can see here, click here to upload a document. Now, for our Epic clients, we have direct integration with Epic. So you can actually preview what's in the EHR and just bring it in. It's an easy button. We are moving on to other EHRs as well. But for Epic, there's direct integration. But where I'm going with this is MDAudit's way of interrogating the medical record. I'm going to go in and bring in this clinic note for this visit, and I'm going to run Auditor Assist. And what Auditor Assist does is it uses AI. You can see here it's evaluating the record, and it's going to provide recommendations to the coder. So as that's running in the background, just to tell you a little bit about it, is MDAudit has now broken into the AI space where we, on the professional billing side, can interrogate the medical record, look at it, see what you have billed, and then give you recommendations on what we are seeing, what that AI is finding for you. And it's running right now. Again, there is direct integration with Epic. But what it will do essentially is after that runs, I'm able to go in, and for our MDAudit folks that are familiar with this layout, this is going to be pretty nice, is Auditor Assist, once you run it, will light up, but in here, it's going to give the auditor all types of suggestions. You can see the codes are over here for both diagnosis codes, CPT codes. It's going to say, hey, this is something that you've billed, but there's no evidence found to support it. Or this one here, it wasn't billed, but it's showing you that it can be found in the documentation. This rhinitis, if I just click this here, it's finding it where it was within the documentation. Same things at the CPT level. The skin testing that wasn't going out on that bill, the AI has found it and suggested it. Now, on top of that, as an auditor, these suggestions that AI is giving, I can go in and agree with them. Or if I disagree for some reason, it allows me as the auditor to go in and give feedback. And this feedback that you're putting in is used to even further train the AI model so it gets more sophisticated and more accurate. So at the end of the day, what I want folks to realize is you can come in and audit MDAudit, but you're getting AI now on the professional billing side as an auditor that's going to help you comb through that medical record, that patient note, that clinic note, whatever it is, and help you find those needles in the haystack that you need to help your auditing workflow. We are at a very high accuracy rate right now. Some of our current clients are using this right now, and we're constantly training the model to have very high levels of accuracy and integrity. We've started this on the professional billing side, and we're now moving on very shortly into the inpatient and outpatient side. But if you are an MDAudit client, and you haven't seen this or heard about it, reach out and ask us. And if you're a non-MDAudit client, we want to hear from you as well for anything, any of the best practices we've talked about today. But that is Auditor Assist, folks. Now, we've only got a few minutes left, so I am going to just answer one of the questions that I see in the chat. And that one is okay. Yep. We just mentioned this, but I know people are already excited about this. For the Auditor Assist, yes, there is direct integration with Epic. In all honesty, we started with Epic because many of the folks in our client base are Epic shops. But we will be moving on to other EHRs. I don't want to commit to which ones those are. I think we may be thinking Athena and others. we can certainly get back to you on that. But yes, that is direct integration with Epic. Folks, I want to let you go a few minutes early. So just know that again, you'll be your poll is up right now. If you wouldn't mind taking that poll, if you've got a few minutes, let us know what you thought of today, what other topics you may want to see in the future. And again, as I said, you'll be getting this deck, you'll be getting the recording, those other educational assets that are baked within the deck. You'll have that to take back to your revenue integrity program. And again, I would just like to thank all of the folks in our revenue integrity audience because over the last 9 years, I've got to learn a lot about what you do every day. And it really is quite admirable how you're a front line of defense in protecting your organization from underpayments, overpayments, and in just reputational risk. And all of the work you do with educating providers and coders. We know it's not an easy job. So hopefully just taking 45 minutes with us today and getting some of this information will help you bring that back to your programs. But thank you for your time, and we look forward to seeing you next month.